Monday, I will present another talk about haploidentical transplant for secondary AML. So secondary AML is a distinct type of AML that, according to the 2022 WHO ICC classification of leukemia, is based on mutation and not more on previous history on MDS or antecedent malignancy. So these patients usually don't respond good to chemotherapy because they are older, have antecedent hematological malignancy, have more mutations. And also in studies that evaluated transplantation from sibling and unrelated, the result in secondary AML was poorer than in de novo AML. However, haploidentical transplant with post-transplant cyclo is reducing the transplant-related mortality and improve transplantation outcome. And therefore, the question was whether the lower outcome or inferior outcome that we see in secondary AML with sibling and unrelated transplantation, we will see the same in haploidentical transplant. And we challenged this question even more because we looked on secondary AML compared to de novo AML, but patients that have active disease. And what we found out that with haploidentical transplant, and this is opposed to sibling transplantation and unrelated transplantation, we don't have inferior results in secondary AML. And this is extremely important because this may indicate that the haploidentical transplant is overcoming the signal of inferior outcome of secondary AML, and it's important for secondary AML, which is much more frequent in the elderly patient and patient with high comorbidity and patient post-chemotherapy and MDS.